All right.
All right,
Wow.
I'm sure this is.
Yeah.
we're gonna go ahead and get started. Welcome everyone to the Cesar Healthcare District Legislative Policy Committee meeting. We'll go ahead and call this meeting to order at 3:01. Do I have a motion to approve the agenda?
Absolutely.
Second.
All those in favor, say aye.
Aye.
Maybe I'll take it here, so okay. Just a moment. Yes, Linda?
Hi there. No, I can hear you okay. I just wanted to, I didn't know the process on Zoom for a public comment when we get there. Thank
Okay.
Thank you. All righty, next item, meeting minutes. Any questions regarding the meeting minutes? I'll entertain a motion.
Second.
All those in favor say aye.
Aye.
Righty. Next item, D, public comments. At this time, comments from the audience may be made on items not listed in the agenda that are of public interest and within the subject matter jurisdiction of the district. The committee has a policy of limiting speakers to no more than 3 minutes. The committee cannot take action or items not listed in the agenda. Public input may be offered on an agenda item when it comes up for discussion and or action. I know we have one public comment online.
Linda, did you have a comment for an item not on the agenda?
Yes, I do. I just wanted to indicate that, there's $233 million that was awarded to California for the federal rural health transformation program. And I'm not sure if through the grant process and as you're looking at strategic goals, if there has been discussion with some of the CBOs and other partners of who in our district boundaries may be requesting some type of funding under the rural transformation program, because it's really focused at, healthcare access, workforce shortages, and infrastructure gaps. And there could be an alignment, there could be partnerships. I know that the Imperial Valley Healthcare District has formed somewhat of a committee to look at how they might be able to collate together and request funds. So time will be of the essence once they, open up the applications, and then it's up to 5 years of these rounds. But I figured from a legislative standpoint, it might be relevant to look at how the district might be able to participate in this, move it forward, or help align in some of these new healthcare access models. That's all I wanted to add. We've been having discussions with the senators and assembly members on ways to enhance access through the healthcare district delivery system. Obviously, Tenet would not be eligible for funds, but we could definitely be part of a hub and spoke piece for the nonprofits that could benefit from, some of the rural areas in our southeast area of the district. So thank you very much.
Is there more? I'm sorry. Go ahead.
Thank you, Linda, for your comments. We have a question from the speaker.
Sorry. Do you have more information on that? Because my understanding, there wasn't a lot of details out on that yet until CMS.
Yes, I'll go ahead and forward what we received from Senator Padilla's office just after a phone call we had yesterday with Sam Roth, as well as a little bit of additional information that's come through some of the healthcare associations. So I'd be happy to forward it to you, Chris, to share with the team.
Thank you.
Thanks.
Any other public comment from there?
No other public.
Righty, thank you. Next item, E, old business. E1, SB 588, health facilities, freestanding emergency center study. Chris, you wanna, why?
Yeah, so essentially, Senator Ochoa Bogue, this was set up as a 2-year study bill. And so going into the second year session, the senator felt that there just was not enough support to move forward on this, felt that it was going to be very challenging to get the labor and the emergency physicians group on board. And even with the new Senate Health Committee chair, felt that that would be too difficult of a task, and she wanted to save her fights for something that she felt more confident in being successful. But there may be opportunity along the way with some emergency health or emergency hospitals, emergency department hospitals, etc. But there's nothing definitive right now that's being supported to my knowledge.
Then also it was suggested that we continue maybe, getting support from other, from their legislators and then potential visit up to the Capitol.
Yeah,
Yeah.
we've actually talked about doing that with Tish to see if we can arrange a time to go up there when the legislators are there.
Yeah, if I may jump in, Chris, I think it's important to note that the new chair of the Senate Health Committee was present and a committee member for the bill's original presentation last year, and was, made comments about not supporting the bill. She did not vote for the bill. So her chairmanship and general position on FEDs, along with the committee consultants remaining the same and their position being unchanged, really made it impossible to not only move a study bill, but to strengthen it or broaden it or even narrow it. Narrowing it further from its current uh, language. I mean, it would have been, I don't know, an effort that was worthwhile for the senator, or, and we certainly didn't want to put other senators in positions to have to weigh in again on the bill. We had a favorable, believe it or not, standing where the former chair allowed for us to move, to park the bill and not put it up for a vote and ultimately have it fail. So the issue did not have a failed vote or passage, and we wanted to keep it that way. So I think this is an ongoing conversation in light of a lot of the focus being on HR1 and the impacts to the healthcare delivery system in California. We think that there are still opportunities for having the conversation. I think a lobby day would be really vital in just continuing to educate members so that if and when we were to want to approach this again, we may have a different outcome. But I think it's going to take a little bit of time and very clearly some additional education and coalition building around it as well.
Thank you.
Um, because of my previous role as a nurse and a member of SEIU, I have some friends in SEIU. And I reached out to them to find out what their objections were. I don't know how far up or down the ladder my friends are, but they're willing to talk to me about it. What would be the best way? Get together with staff or, get a Zoom call going? But I personally don't feel like have the best information about the bill. And also they said that they were busy working on the millionaire's tax.
Yeah, SCIU is spread pretty thin right now. It was the state level SCIU folks that were adamantly opposed to the concept. And sometimes it is helpful to start the conversation at the more local level. So it's a good question. I think that is something we can consider trying to reach out and when they've got time to just have a preliminary kind of exploratory conversation just to learn more about their opposition. I mean, they certainly um, showed up in force for this hearing, but I think, there's some potential just to try to drill down into exactly what the opposition is, but usually that helps starting at the local level.
Tish, did we get a formal opposition or letter from them?
Yes, and they showed up in committee and were the primary witnesses in opposition.
I remember.
So it sounds like something we should explore.
Yeah, I mean, I'm happy to forward that letter. Most of the time, uh, I think their whole stance was that to turn, to instead of using the model and doubling down on the model that and focus on the existing structure, that it doesn't make sense to put up FEDs that are going to be charging in their view, exponentially more for the same services, and simply because they're an emergency room department, so or an emergency department. So their whole take was affordability and costs. But maybe in person they'd be willing to share a little bit more information, although I'm not confident about that.
Thank you.
Mhm.
One of the items on our agenda is the special districts legislative day, so there's a chance that members of the district will be up there April 7 and 8, so that's an opportunity where we might be able to meet with some folks up there. But Greg, do you have any questions on this item? Alrighty, so we're good.
Can I just make, is this something we could attach to our strategic plan and just pay for the, like, a feasibility study on our own? To see?
So my recommendation against that is because even if we do conduct the study, the legislature might not even consider it at all, so we would just end up with a study, right,
Okay.
that tells us that we need it or we don't need it, or, but
Mm.
that's something that we had not considered, but that come across. But I'm not sure, right, at some point, we might wanna do that, but I wouldn't move in that direction unless we have a commitment that it would be able to be used in a bill, or that they would take rest of the study.
Yeah, they'll question the validity, the findings.
Right.
And it's why we wanted to have an impartial state-sponsored study done. And even and what's interesting is that we had such strong opposition from SCIU on just a study bill. So, and there's plenty of data that would support, at the very least, looking into it, and they still had very strong opposition. So I think the issue is twofold. It's educating, building support, and then trying to address SCIU's concerns because they are a formidable entity within the legislative halls.
Thank you. Any other staff member questions? No? Alrighty, next item, E2, AB 2019 healthcare districts. Will that be you, Chris, or Tish?
Sure, I'll go with it. So we had talked at our last meeting about trying to understand what the definition of the word meeting and technical assistance. And so in discussion with legal counsel, we decided that it might be better to, instead of trying to poke the bear in a sense with the author of the bill, it looked like there might be some opportunity for flexibility in the actual policy that we have. So it asked Jeff then to help us with some proposed language in the policy. And what you have before you on whatever page it is. The page 16 of the packet.
It's section
It's
1.2.
page 2 of the grant,
Yeah.
of the policy.
That's what I'm looking at.
Specifically section 1.2. There you go. Page 17.
Yeah, so the proposed revised language is to read, in accordance with this grant policy, staff may meet with grant applicants to provide technical assistance to ensure that all grant applications, including mini grants, are appropriately developed and align with the strategic plan and mission of the district and foundation and comply with the standard grant terms and conditions. So this is focused on the district staff being able to meet with grantees and such actually prior to the application of the grant. But still trying to keep in mind of that the board members are limited in that regard.
Any questions on that?
I have a question. Well, the problem is that it's still a muddy gray area, especially in terms of district directors. at one point in time, I was told by one of the attorneys that were advising us about something that I shouldn't even give my business card to anybody asking about a grant. So, you know, we have conflicting ideas, and I think that we should go back to the author. I understand from, was it Tish that said that she was amenable to suggestions on what some wording might be?
Tish, could you,
No, I apologize. No, the author did not express any willingness to go in and adjust. I think that we run the risk, we'd have to get her blessing to move in any direction with this legislation. And we run the risk of upsetting her and seeming to unravel the bill that she was pretty aggressive in pursuing and passing. But no, we did not get any indication from the author's office that they would be willing to make any sort of changes, no matter how narrow or minor, um, to the original bill.
I think what may have been understood with that was that we were trying to engage meeting with the author, but there hadn't been any specifics discussed about, and so, what leads to the comment from Tish is that, there probably wouldn't have been great support, and then we were also concerned, could it go the other way? Could, if you look at making it even more restrictive?
Because there's so much talk about accountability in Sacramento right now that there's no way they're gonna give any impression that they're taking some of that back, especially for elected officials. So,
Yeah, we approached the original author's office, in trying to set up a meeting. We were greeted with skepticism. We considered sending in, or working with other groups to also help facilitate a conversation. But I agree wholeheartedly that the dynamics in Sacramento right now could actually have the opposite effect here and make it so that they actually tighten communications even further.
Thank you. So, staff is good with what legal counsel provided and the policy. I'm assuming this will be going to policy committee.
As
or-
well, yeah.
Mhm. We don't, it's not an action item for us. Is it?
Um,
Approval?
shouldn't be, right, because it's a policy change, right?
We should have it as an action item,
It's
because I would
still
like
their
to get.
consideration to approve.
Okay.
Yeah, I would like to have the committees, so that's, part of our purpose is getting approval at this level, and we'll take it to policies committees and the board.
I read it, I think it reads well, again, knowing or my concern mostly was making sure that we had a good understanding of what the bill was and that our staff was comfortable with what that was going to be, and from previous comments, was also that if we didn't have to, but what did you say, poke the bear? We were
Yeah.
going to do that, which I think that we don't have to. I would recommend, and I mean, right? Consult with Jeff, right? Within those, specific examples that you have, and hopefully he'll be able to provide you a better answer. I'm not telling you to go out there and not obey the law, but, I would
Yeah.
imagine that sharing a business card with someone
Yeah.
wouldn't mean breaking the law. If it does, don't do it. So.
And I would point them to the website,
Well, that's what I do.
so hand the card.
And I circle the website
There you
name,
go.
and then I write menu on it.
There you go,
And
yeah,
go there.
that I think is.
That's it, yeah, and you'll come bail me out of jail.
Alrighty, so, any public comments on this item?
I believe so. No public comment.
Alright, I'll entertain a motion.
So moved.
Second,
Alrighty, all those in favor say aye.
Aye.
Alrighty, motion carried. Next item is F, new business, F1, California State Assembly Committee changes. Trish, do you wanna give us a little update?
I think I'll turn this over to Tish, if you don't mind. These are the reports that you've provided.
Yeah, let me go ahead and pull that up. I feel like it was a lifetime ago in legislative time. So I think obviously the most notable change was going to be on health committee and the budget committee. So as of right now, let me pull up here. Sorry, my apologies. Obviously, we had Senator Menjivar on the Senate side. She has been replaced with Dr. Weber Pearson and for the chair of Senate Health. Let me pull up the others here. I think that's probably the most remarkable. Are any of you have worked with Senator Weber Pearson in the past at all?
No.
Okay. Sorry, let me pull this up here. Um, Appropriations Chair was updated on the Senate side to Senator Sabrina Cervantes. Senate Appropriations Committee is one of the most influential, most powerful committees in the legislature. So that was a significant change as well. Originally, it was a Senator Caballero. And then on the budget side, let me pull that up here. The biggest change was to their chair. It is now John Laird. Senator John Laird, before, he was in the assembly for a number of years and then went on to be the Natural Resources Secretary and is now the committee chair for the budget side. So as of right now, obviously, we're in between the governor's January budget introduction and the May revise that'll be coming out. Senator Laird and Assemblymember Jesse Gabriel are leading those conversations for their respective houses. And once the May revise is acted upon or is provided by the governor, the legislature will take that and then respond to the governor's proposal with their version, and then negotiations will begin on a finalized budget. So those are the most, you can see that I've included every change there, but the most relevant to us is going to be appropriations, health, and budget.
Thank you. Any questions from committee members? Questions from staff? Alrighty, let's move on to the next item. Teacher memo. Item F2.
Yeah, so this is the budget and health committees are meeting in joint hearings, informational hearings, with a heavy focus on the status of the healthcare delivery system in California as a result of federal changes. The overview that you have here is from a hearing in, I believe, late January. We actually had another hearing by the budget committee yesterday to look at impact to delivery currently. And I'll just quickly go over some of the highlights. They kicked off the hearing by citing some pretty sobering numbers. The California Budget and Policy Center estimates cuts as a result of HR 1 could result in 2 million Californians losing Medi-Cal access and equaling about 2.3 billion and 5.1 billion per year in costs. The California Healthcare Foundation projects 30 billion per year cut from Medi-Cal. In 2024-25, the federal government covered 62% of the Medi-Cal budget with 22% from the California General Fund. So they really took yesterday as an opportunity to work through the specific provisions of HR1 with a focus on work requirements, and outlined that the introduction of work requirements and along with the 6-month eligibility redetermination was, I believe they refer to it as a policy about paperwork, and create scenarios where otherwise eligible working parents will lose coverage because they can't navigate the verification process in time. The other focus was on immigrant coverage. So effective October 1st of this year, federal financial participation for emergency services provided to enrollees with the unsatisfactory immigration status will drop from about 90% to 50. And the administration will plan to apply work and community engagement requirements in addition to that. They also looked at covered California subsidies, and the fact that HR1 eliminated eligibility for premium subsidies for lawfully present immigrants with incomes below 100% of the federal poverty level who are ineligible for Medicaid due to their immigration status. So effectively, they may still enroll in a covered California plan, but only at a full unsubsidized cost. And then lastly, they focused on the change to dental coverage. So as of July 1st, 26, the full scope state funded dental coverage will be eliminated for Medi-Cal enrollees with unsatisfactory immigration status. So obviously this hearing was an opportunity for legislators to express their frustration, their concern, and essentially lay out, the landscape ahead of budget negotiations, and express the need for California to respond and try to make up that difference given the fiscal status that we're in now. I think it's also worth mentioning that as returns start coming back, we're getting more information. It does look like there's the potential for a surplus this year, but with drastic deficits in out years. So the question before the legislature will be and the governor, how do backfill what's going to be devastating cuts as a result of federal action, while also knowing that even if in the time of a 1-year surplus that we're going to have dire circumstances in the out years, how do you balance that and try to look at securing longer term revenue? The Senate Budget Subcommittee will be meeting on Health and Human Services. Will be meeting tomorrow, starting at 9:30 a.m. And so will be seen as a continuation of this discussion on the budget side.
Thank you for that update. Any questions from committee members? Any questions from staff? All right, thank you. Thank you, Tish. We're gonna go
Of
ahead.
course.
On next item is F3, California Special Districts Association, CSDA, Special District Legislative Days. Let me Tish or you could.
That just information, and I believe Andrea had sent out the message regarding this legislative days session. And those that are interested in attending, hopefully have responded. And who all from the committee is attending?
I can go.
I'm planning on going. You're going?
Mhm.
Good.
Will you be?
I can go.
Okay. Did we open the invitation?
To everyone, yeah.
Okay, alrighty. Any interest from other board members?
No one's responding, other than Greg and Carol. Unfortunately, they're.
I think you think it was important for us to include it in this meeting's agenda. Mhm. Okay, alrighty. Any committee member comments? Sure.
I'll actually comment on just as on the budget, especially around HR1. I said this in our meeting earlier, is that the county did a year budget update, and primarily focused on the impacts of HR1. And I know that CSAC, the California Association of Counties, is going to heavily lobby that the state needs to backfill because it's a drastic impact on the county's finances around health. So that's all.
Thank you. Seeing no other committee member comments, we'll go ahead and adjourn this meeting. Thank you. Thanks.
Thanks, Tish.
Thank you.